So I'm so excited that on the Zing Wellbeing podcast today, we are joined by the incredible neuroscientist, Dr. Jennifer Hacker Pearson. Now, Jen also, as well as being a neuroscientist, is an author, and you have a fantastic website, which is drjen.com.au. Thank you so much for being here.
Thank you so much for having me.
Now, I'm so excited to talk to you today. I actually asked in our menopause group that we have, what questions did you want to ask Jen? And there was like a flurry of questions because, you know, we were just talking before we started there, but there is so much information that women don't have about menopause, perimenopause and the brain, right? And that's what we're going to talk about today.
Yeah. Unfortunately, it's something that catches a lot of women, most women, I would say, by surprise. And it's such a shame because we really should know what's coming next.
Yeah, it's true. And what I find just fascinating is how much the brain impacts our well-being, our health, and then when we're in perimenopause or menopause, the effect that has on the brain.
Yeah, exactly. I think we underestimate the power of the brain in daily life anyway, regardless. But certainly when we come into perimenopause, the brain is regulated by estrogen. And so when the estrogen fluctuates and it declines, the brain goes into kind of a chaos. Yeah. And we don't talk about that. We don't really know that. And women think it's all controlled by the ovaries, which is where the estrogen comes from. But actually, it's the turmoil in the brain that causes many of the symptoms that we see in perimenopause.
Wow, it's actually quite scary, isn't it? Because you think the brain is so powerful, and then the impact that dropping estrogen has. So talk to me, because I am a total layman and I am not a neuroscientist at all or have any clue about it. But what is happening when that estrogen is dropping, and what effect is that having on the brain? And then how does that materialize into, you know, the side effects that so many women are seeing?
So the brain is really rich in estrogen receptors. There's estrogen receptors all through the brain. And in order for the brain to do what it needs to do, estrogen needs to bind to it. So if you think of it kind of like the estrogen receptors is a light fitting and estrogen is the light bulb, if the estrogen, the light bulb, doesn't come into the light fitting, there's no light. And so as the estrogen is declining and fluctuating during perimenopause, there's less light bulbs. And so the brain isn't as illuminated, which results in, you know, actually less brain energy. And you can see that in scans of less lit up areas in the brain, which is really fascinating, and a decrease in brain volume, and also there's changes in structure and function in the brain and brain chemistry.
Wow. And you mentioned before, which I thought was so interesting, that that kind of drop of estrogen is quite similar to the drop of estrogen that women have once they've had a baby, and you kind of on trimester 3, and then you have the baby, and then it just plummets.
Yeah, so it's a bit more severe in pregnancy, obviously, because the estrogen levels get so high in the third trimester, which is really important for brain changes as well. The brain is changing for you to become a mother, and then as you deliver the placenta, it just plummets. But then if you breastfeed, it fluctuates up and down, which can mimic perimenopause. So that's why sometimes women have hot flushes, or they have like difficulty sleeping, or there's some anxiety and depression. So it's very much connected, and we don't often talk about that. And I'm also very interested in women that are older, because we're having children older now. Who are going through postpartum and then having an overlap of perimenopause and not realising what's going on with me.
And you know what? Now you say that, it's just triggered a memory I have from 14 years ago when my first baby was born. And I remember I used to go through stages in those first couple of weeks of breastfeeding of being really hot, but then literally shivering cold. And is that all connected to that?
It's all connected to that. It's all kind of happening in the hypothalamus, which is sort of the beginning area of that cascade of information from the brain to the ovaries to increase estrogen, and also part of fertility and menstruation.
Wow, unbelievable. So when that happens, when you're in perimenopause or menopause and that brain is being affected, what is the manifestation of that in a woman's body? And like is it the brain fog? Is it depression? Is it anxiety? How is that kind of coming to life?
So many of the symptoms that we see initiate in the brain. And like you said, brain fog, hot flashes, anxiety, depression, overwhelm, increased stress, not being able to handle stress so well, a feeling of dread, or, you know, even just like, who am I? I don't know who I am anymore. I don't feel like myself. You hear women say that a lot. So that all comes from the changes in the brain and the chaos in the brain.
Wow. And, you know, have you had much experience of looking at women who've had HRT? Does that help, that chaos, or is it just a mask? Like how is that working?
The majority of women will benefit from HRT. I think it's perimenopause is a very nuanced experience, and so while the experience is nuanced, the sort of support has to be nuanced as well. There's no one size fits all. Yeah. So there is studies done that HRT definitely, we call it menopause hormone therapy now because
sorry.
That's okay. No, just because HRT also, it's not replacement of the hormones, it's more supplementation. And plus what has happened, 20 something years ago where they're sort of demonized HRT. We try not to use that. Well, I try not to use that anymore because I don't want people to think that they're going to die.
And I think just on that point, I have talked about it on a different podcast as well, but I think it is important to talk about it because there is a lot of confusion over HRT, because there was that study done 20 odd years ago, and it's been now proven that wasn't correct. But it's where a lot of the demonization, and it's unfortunately, even, for myself, before I learned about why that study wasn't correct, you just have this niggling thought going, HRT or MHT isn't good for you, but it's actually been proven false. And it's really important to educate ourselves so that we understand the information we're getting is correct.
Absolutely, yes. Yeah. And there's been a lot of, there's some parts of the study that were very good. Yeah. They weren't highlighted. You probably don't even know about those parts. And then there were some parts that would have been debunked over and over again, especially the breast cancer risk. Yeah. So that's incorrect. So I think it's very important to understand what is true and what is not true, particularly for yourself. Yeah. Because we're all so different. Yeah, absolutely. So other than, HRT, because a lot of women don't want to take HRT or for whatever reason they can't take it. If they are listening here now and going, yes, that's me, I've got brain fog, anxiety, feeling overwhelmed, what tools can they do, and is there things that actually genuinely do help? If they don't want to take HRT?
Yes.
Okay, so I think the brain is fueled by the food that we eat. So it's very, very important that you have a good diet with nutrients that can pass into the brain. Yeah. So the Mediterranean diet comes up all the time. It's a very quick sort of overall of, omega-3s, green leafy vegetables, and anything that contains zinc, magnesium. There's definitely those kind of supplements that you can take into your body. And I'm a big believer in brain training as well, that the International Menopause Society, I think it was, have said that along with HRT, cognitive behavioural therapy should be used in the treatment of perimenopause symptoms. While I don't do CBT, the training of the brain that this kind of encompasses is really, really important. You want to make your brain strong and resilient so that it can deal with upsets like perimenopause. But that's something that is good for you in the future as well. Yeah, okay. And can you explain what cognitive behaviour therapy is? Because a lot of women, again, listening to this going, I don't know what that is. What is it? You don't have to go and do cognitive behavioural therapy by any means, but it's psychologists will do this where it's you're training your brain through behaviour. Okay. So say, as a really crude example, if you're afraid of spiders, you might, subject yourself to spiders. Don't have to touch them, but just torture. Yeah, that sort of thing. Just to reduce the fear, I guess, in that sense, of spiders. So it's like an exposure therapy. Okay. And if you are in perimenopause or menopause, what is that doing for you? Because how are you kind of using that to kind of train your brain? So perimenopause, as with pregnancy, is a time of extremely high neuroplasticity. Okay. So that's why your brain is changing itself. In perimenopause, it's trying to figure out how to do the things that it needs to do without the estrogen. Okay. So I think that's why it takes so long, because it's a huge thing to not have suddenly, this estrogen. But the brain is very adaptable. Okay. And so it's the perfect time to train your brain and to start, thinking about how you want to get through perimenopause, but also who you want to be on the other side of perimenopause and how you want to live your life and, what you want to get rid of and what you want to gain. And yeah.
So my question on this is that so the women's brain has a lot of estrogen in, right? And we're losing it, so our brain is adjusting and trying to cope with it. So my question is, men's brains, do they not have that estrogen? Do they just operate it as we would post-menopause?
No, men have estrogen as well,
Okay.
but their brain is sort of driven by testosterone more.
Okay,
so, yeah.
okay. So are we at a disadvantage as a woman that we're losing that estrogen? And if we're not having, hormone replacement supplements or therapy, are we at a disadvantage from a brain functioning capacity?
It depends who you talk to.
Okay.
So some people will say, no, it's very natural and this is what is meant to happen and what is meant to, what we're meant to go through. And then other people will say 100% you should, if you can, take the hormones to replenish because the brain is thirsty for estrogen. There's studies been done that show that actually the brain produces more estrogen receptors in perimenopause because it's trying to mop up all the estrogen that it can find, the little bits that we have left. So it depends who you talk to. And like I said, it's a very nuanced experience. And so it really depends on the person. But in theory, in my theory, if you're losing estrogen, you want to try and replace some.
Yeah, okay. And what is your thoughts on testosterone? Because there's a lot of talk around, for women, testosterone therapy, a little bit in the menopause and perimenopause can actually help the brain. Do you have any thoughts on that? Because I've read about it and there does seem to be some good early studies of it, but I haven't really delved into it.
Very controversial topic.
We like to be controversial.
So generally,
yeah.
Testosterone is prescribed for low libido in women, postmenopausal women in particular, and the data isn't very concrete. There are some studies coming out now saying that it is enhancing women's well-being during perimenopause, but again, it's a nuanced experience. How many times have I said that? In that the woman needs to feel that it is actually beneficial. For many women, it does nothing.
Yeah. Okay.
So my advice would be is to go and find a good GP who will try this out with you because it's probably not going to hurt you. That's kind of what we know. The tiny microdoses that women get. You need to be somebody who knows how to dose it properly as well. It's probably not going to hurt you. So if you want to give it a try for 6 months or so, see if it makes a difference, and then go from there. But it's definitely not something I would lather all over myself because, your voice will drop and you will grow hair in places you don't want.
Yeah, right.
Yeah.
And is that why it's controversial?
It's controversial because the data isn't there.
Okay.
And there's two camps at the moment about whether testosterone should be used for more than libido or whether it shouldn't.
Yeah, right. It's such an emerging time, isn't it? Because we, from what I've seen, there hasn't been an enormous amount of research into this area of women's health. It's getting more, but it's still very small next to a lot of the big health issues. But I feel like, in 10 years' time, we'll have so many more things, right? It seems to be developing so quickly.
Yeah, and I think that's part of the problem is we're at the very beginning of this race, and so the data just isn't there. And we do need data to give us an overview of what is happening and what benefits of medications can be, but we have to also remember that we're treating individuals.
Yeah.
So, we need the data 100%, but we also need to remember that each person is different and every person's brain to the point when they become perimenopausal is different. So the neuroplasticity of the brain is always there. It's just heightened during perimenopause. And your brain changes as you go through life. So depending on your DNA, your psychosocial history, your neuropsychological history, your actions and experiences, your values and beliefs, everything shapes your brain. So when you come to the beginning of your perimenopausal journey, your brain is going to be different to my brain. So everybody needs to remember that there's an individual person behind that data that we're looking at.
Yeah, wow. And with brain fog, I suffer from it sometimes. I do a lot of work on my computer and I'll be in the middle of doing some work and I'll suddenly go, I don't know what I'm doing. And do you know what I do to remember? I press the paste button on my computer. Oh, that's what I was doing. Because I remember then, because I'm always usually copying and pasting and doing things and writing. But it happens a lot. So what is it that what is it that's happening for us to get that brain fog and just forget stuff?
We don't really know the underlying thing. Like it's just the upheaval in the brain. It's very common, but brain fog is actually sort of not recognised as a symptom as such.
Right.
It kind of falls under cognitive function of the brain. And there's also some debate about whether it's real.
Oh, it's definitely real.
It's real, I know. I have
real.
the same. I did a podcast yesterday as well where I forgot mid-sentence what I was saying.
It's so funny though, because I've always had a really sharp memory and brain, like I always have. I can do multiple things, and it's noticeable for me if suddenly in mid something I'll go, I have literally no idea what I'm doing. And one of the questions actually that was posted in the group that we've got, someone said, is there any evidence of linking to dementia for women?
Yes, there is some evidence. There's evidence to show that the lack of estrogen can lead to neurological disease later in life. Obviously not in the perimenopausal period, but when you get older. Yeah. But that's not for everyone. And that's also why the hormone therapy is that, it can prevent that. And there's some studies that have shown that HRT can reduce the chance of Alzheimer's in people that are prone to it, that have got those, exactly, prone to it. So there are risks associated with the lack of estrogen that we definitely need to talk about. Yeah. And these aren't just in the brain, they're all through the body. Yeah. And this is also emerging data of what is happening, because I think it's important that women can prepare themselves and make decisions based on what we know may happen. Yeah,
I know it feels like that when you're in your early 30s, you coasting along and life's hectic because, we're getting older as having children. So, a lot of women in their 30s in the thick of motherhood and nappies and bringing up children. And then suddenly it just hits you right into that perimenopause stage. And a lot of women don't know even what's happening. They just think they're grumpy or, or just sad or depressed. And I think that if we can learn and equip ourselves with the right tools, it is going to make it easier.
Absolutely. And menopause is extraordinarily subtle. So, perimenopause. So we may not even feel that we're in perimenopause until the symptoms get a little bit more severe. So in the very beginning, and they'll come and go, so you feel overwhelmed or stress or something and just think, I'm just not coping with life. And then it kind of gets better, and then it comes back, and it stays a bit longer, and then it's a little bit more severe. And often it's only really in hindsight, it was for me certainly, that I went, oh my God, this has been going on for years. And I just didn't recognise that was what it was, because I also had small children. We moved countries. You've got life, businesses, houses, husbands, all the things.
All the things.
And so it's important for women to understand. But then I think we need to be careful also to not really quickly jump on the perimenopause bandwagon when we're having a stressful or an overwhelming day and go and run and get some HRT, which, that's not going to happen anyway. But I think
it's true, yeah. And I think that, like for me, my mum had early menopause, so I knew when I was just turned 40 and I was feeling off, and I felt I didn't go straight away, but I was feeling significantly off, and it was the tiredness for me was just like next level, and I had terrible restless legs all the time. So I did go to the doctor, and I said, I think this is what's happening for me. He's like, how can we test it? And then we had to go through so many different tests, and then it came back with, yes, your kind of ovaries or the hormone creating is significantly down. You are definitely in perimenopause now. And it was kind of like it was good to know. It was just good to be aware. So I could go, okay, I thought it was that. But I didn't. But I think of a lot of women whose mothers haven't had that early menopause and they're going through it, whether it's early or whether it's late. It's just understanding what those symptoms could be and when to go and get help.
Yeah, absolutely. And I think some women don't talk to their mothers about that. That's also, it's a topic that might not be something you want to discuss, or your parent has passed away and you can't ask them. Yeah. So I think it's important to definitely, keep a lookout. But I'm not sure what tests they did with you, but there's generally no test for perimenopause because the whole hallmark of perimenopause is the fluctuation of hormones.
Yeah.
So testing hormones definitely doesn't work because it depends on where you are in your cycle. I think they can test your egg supply.
Yeah, they tested egg supply. They did blood, egg supply, and there was 3 of them, and I had to go through 3 different. It was invasive, and it was, it wasn't great. But at the end, when they said, I got the letter from the gynecologist saying, yes, your it must have been the egg supply or ovaries or something was so far down that yes, you are in perimenopause. And but they did say you couldn't just do a blanket blood test. You can't do that. You don't know.
I'm hoping we'll develop one though, because I think women deserve to know. So I think until then, we all need to just look out for ourselves, and we need to say how you feel. Maybe write it down, write a journal of what happened, especially when there's sleep disruptions, things like that. Strange anxiety. Hot flushes generally only come more towards the end of perimenopause. So perimenopause is the time around menopause. Menopause itself is 1 day.
Yeah.
So menopause is 12 months after your last period. That's how much we can't measure it, right? We have to actually just wait until we haven't had a period for 12 months, which is insane in 2024.
It is.
But anyway, so peri in medical terms means around.
Yeah.
So perimenopause is the time around menopause, which can be 4 months to 10 years before that menopause day, and then also after. Because once menopause hits that is your 1 day, the brain isn't just suddenly go, bang, I'm fine, no, everything's okay now. It still needs to work itself out. So it's almost like a coming on and a coming off this period. Yeah. And I've heard of women that are even in their post-menopause era that still have the odd hot flush. Yeah. So it's not it's going to be just over suddenly and I'm fine and I'm home and hosed. But yeah, it's a process.
It's a long process. And with the hot flush, what's happening to the brain? Because I remember speaking to someone and they were saying that hot flush is not good for the brain because the brain shouldn't be that hot all the time. It's a negative thing, which is why you want to try and stop them. But what is happening to create that hot flush?
So there's a disruption in the brain in the hypothalamus, and it thinks that you're cold, and so it becomes hot. It's like the thermostat is out of kilter, and so it suddenly makes you very hot for no reason, and that's again the estrogen signaling isn't there to give the right messages. So the brain is like, oh, okay, yeah, I can do that, no problem. And you're right, yes, it is dangerous, it is damaging for the brain. So hot flushes are hot flushes are dangerous for the brain. A lot of it's dangerous for the brain.
But I think on that point, a lot of women just go, I'll put up with it. I'll battle through it. But it's not good, right? Because it is dangerous for the brain. So if you are getting hot flushes, you should go and get some help.
Yeah, absolutely. Especially if it's debilitating for you for everyday life or for work. There is no medal for white knuckling through it. Yeah. So definitely get some help. It doesn't need to be HRT. There are now other medications on the market for hot flushes in particular.
Oh, really? Like what? What kind of stuff?
Duoviv is a new one that works in a different way. That's not a hormone.
Okay.
Now you've put me on the spot. I can't remember
but
the
like
name
supplements,
of the others.
Like natural supplements.
There are natural supplements as well.
Maca, is Maca good? I always hear Maca's good.
Hit and miss. It depends on the person. Yeah. So the studies aren't there to say that this definitely works. But for some women, they work. Yeah. And a lot of women that take supplements that are thriving, that love them, that think they're perfect. Yeah. It's exactly what they needed. And then I know other women who absolutely say, no, did nothing for me whatsoever. So it's a bit of a trial and error time.
Yeah, totally. Now, after we've gone through menopause, and we're fully out of it and it's long gone, what's happening to the brain then? Has the brain just recalibrated? Is it a lesser function than it was pre? Like, do we know anything around what it looks like for women who are post-menopause?
Generally speaking, the brain kind of recovers. Yeah. So it kind of has a rebound in that memory, in that kind of the brain fog kind of goes away. The hot flushes should go away eventually as well. And you go to basically an age related memory, like compared to men, you're similar, right?
Yeah.
But we don't really have any sort of the long-term data yet to see what is happening. So women feel better. And obviously you see a lot of women walking around that are perfectly fine, that are, you know, functioning fine, that probably never had any HRT because if they're older, they went through the whole WHI debacle and either they started hormones and went off them or never started them in the first place. So, you know, there are a lot of women that will be fine, and then others that are not, where it's actually the catalyst of illness.
Yeah, wow. And just a question on estrogen and the lack of it and the brain needing it. Is there any positive effects of phytoestrogens to kind of compensate?
It's, again, hit and miss.
Yeah,
like the data's not really there.
Yeah.
They're not very strong. What we're losing is estradiol. Estradiol is the type of estrogen that makes us fertile, and the only way you can replace estradiol is by taking estradiol.
Yeah, okay.
So anything that's like a phytoestrogen, that's you know, what do you call them, like soybeans and soy milk and that sort of stuff. It's minimal, if anything, and the studies just aren't there to say that they're effective.
And are there studies being done to see in the future for that, or is it just nothing's being done to actually look at this in a minute? Do you know?
Studies always revolve around money. And so money just hasn't been invested into women's health in general. And as far as I know, there is no money happening for those studies at the moment, but I might be wrong.
It's terrible. I don't understand it because, you know, half the population is women. And it's like we're all going to go through this. So I find it unfathomable that we're not having investment into this area because, you know, like I personally find that I have a lot of tofu and soy, a lot of plant-based food, and I really do find that helps. I really do. I find that helps, and I find I'll do 90 to 100 grams of protein a day. So I really focus on those things, and that genuinely helps me. And it also gives me, I don't want to say a purpose in life, but every day it's my goal to make sure that I have to look after those parts of my health, because I know if I don't, I'll start getting, the symptoms back. So I find it really does help, but it would be great. And I understand that it's personal for everybody, but if there were studies that showed, you know, if you eat this or do this, then 60% of women will see improvements, because nothing works for everybody, no matter what it is, right?
No, that's right.
And it's just such a shame that there isn't investment.
It also depends on who does the study, because often the studies are done by somebody who wants a certain result. So you need to take those with a grain of salt. They need to be independent studies, really, for it to have any benefit. But I just wanted to add also to your saying that you eat your protein, which is amazing, and you know your tofu, and you probably take vitamins. It's also really important to work on your brain health. So you need to train your brain like a muscle. So you need to do brain training exercises. You need to make sure you think right. You need to make sure you eat right. You need to make sure you drink enough water. There's a lot of things that you need to do to look after your brain health, because if your brain health is no good, then your body's not your rest of your health. I don't know why they're separated. I don't know. They're one thing, but you know, they're connected. And so I think we focus a lot on physical health and not so much on the mental health. And the mental health aspect through the perimenopausal period and beyond is extraordinarily important.
Can you give us a few brain training exercises or tell us what we can do? Because I'm going to go and do them after this.
Yeah, great.
Tell me what to do.
So I think one of the most important things you can do is watch what you're thinking. We forget that there is a constant chatter in our brain, like constantly telling us, this is good, this is bad, I shouldn't have said that, I should have said that, I should, you know what I mean.
I do, constant.
So I think watching that is really important, and just being a little bit curious about it and questioning it and going, because that person didn't ring me back, does it actually mean they don't want to talk to me? Or is it just that they got busy, and just kind of not reframing it in kind of like a Pollyanna way, but just making it more realistic and asking the question, is this actually what it is? Yeah, okay. And the number one thing, so if you think of the brain like a muscle and you want to train it like a muscle, you want to use like what I call mental dumbbells. And you walk into a gym, you don't pick up a 50-kilo dumbbell and go, I want to get biceps. Well, some people might, but it's not going to work. No. So you walk in and you pick up maybe a 5 kilo or something like that. And one of those really simple but extraordinarily effective mental dumbbells is meditation. Okay. And meditation, I know for a lot of people, brings up these images of like, oh my God, I have to sit in a lotus position and chant and can't empty my mind. I'm crap at meditation. People tell me that all the time. I'm crap at meditation. I'm like, you can't be. It's impossible. Yeah. Meditation is really just being aware of what is going on, like whether you sit down and you focus on your breath, or, you close to the beach, you listen to the ocean, or even if you just listen to the whirring of the fridge, like something just to focus your mind on. Okay. And I became extraordinarily fascinated with meditation because I realized that I found the science behind it, which is incredible. Meditation is so good for your brain and your body and your mental well-being. But connecting the neuroscience and the mind with meditation was important to me. So I actually trained as a meditation teacher in 2020 as well, because I wanted to teach my clients this very simple and very effective mental dumbbell of meditations.
Oh, I love it. I'm fascinated. I think we've got to see if you can do some meditation for us, because this is incredible. And I think that I'm hands up guilty of always going, I can't do meditation, because I'm like, I find it very difficult just to be still and sit still. But if you're there, you're just focusing on the whir of something or the ocean, that makes sense to me. So I'm a very logical person. I need to understand the benefit and reason to doing something. That's just me. But the way you explained it has made me look at it differently.
Yeah, and I've actually got a meditation. I'm going to give it to you after this.
Great.
It's and your listeners are welcome to download it. It's on my website.
Yeah.
It's free meditation, morning meditation that I created. I actually created it for myself many years ago because I was busy. And I wanted to do the meditation because I knew the benefits of it, but I didn't have the time to sit down for 20 minutes before kids wake up or whatever and the day started. So I created one that's 5 minutes. So it's really powerful and impactful, and it's guided. Yeah. So I speak to you while you're doing it.
Oh, I can't
wait.
So
you can focus on that. And then welcome to download it from my website. And I think that is the beginning. Meditation is the beginning of learning to train your brain, and also getting to know your brain and getting to understand yourself, because understanding yourself through this perimenopausal transition is really, really important, so that you can decide and you can keep training your brain to become the person that you want to be. Because this is the time. Perimenopause is a gift, even though there are negatives associated with it as well. It's a gift from a neurological perspective, where your brain is so adaptable. So you have the choice of how you want to live through this period and how you want to live through life. And with the right education and the right tools, that you can get there.
Amazing. Well, look, it's been fascinating talking to you today. Like, you're just a fountain of knowledge, and I just think it's so interesting, the impact, how much the brain has on everything. And I think that I agree that there's a lot of focus in this world we live in on physical health and physical fitness. But one of the things I'm really passionate, same as you, is it's bringing that across onto the mental side as well, because our mental health has, probably more of an impact on our health than everything else. Because if you're not mentally in a good place, you're not going to be doing anything physical. You're not going to be, because you're just in a depressed state.
Absolutely.
And I think that mental well-being is something that is overlooked all the time and not talked about enough.
Yeah.
So amazing talking to you today. Thank you so much for coming along.
You.
It's been fascinating, and I'll definitely be checking out the meditation.
Awesome. Thank you so much for having me.
Thank you.